Well, after spending 4 days for 8 hours each day creating content together, we have finally detoxed. The Matthew Holt hangover is over, and we are back. It is the September 23rd episode of Health in 2.0. Back. I can finally begin my microdosing regimen of your personality again.
Really? It was all too much for you having me there the whole time?
It was a lot. And in person. We haven't been in person in forever.
Well, it was weird because we were in person and no one else was, right? So we were in a hotel room together with the ironing board as the host of the studio, and then we jump in front of the camera, and we had our friends from ICV and GHA doing the stuff, JC doing the stuff. But yeah, it was all good. Lots of people live, lots of people in the studio.
VCs. What's next for healthcare? Version 1, huge success.
It was good. No, we enjoyed it, and there was all kinds of interesting stuff. Lots of fun panels on primary care and the hospitals, and on what was the "Somebody Give Me My Stuff" panel.
What?
A certain Jonathan Bush said at one point that we're moving from more disruption, please, to a certain group of people to give me my stuff.
Yeah, we went, this was the Who's Drinking Judy Faulkner's Milkshake panel about the companies building the new health IT infrastructure. So Roy Schoenberg from AML on there, Jonathan Bush from Zeus, Sean Lane from Olive, and Nico Skivaski from Redox. And yeah, Jonathan Bush has moved on from the ever so polite, more disruption, please, to now the bitches give me my shit era.
You're allowed to say that. I was going to be, well, you can say that because,
I can say that because it's cute when I do it.
It is cute when you do it. Yeah, it's fun and games. There was a lot of interesting stuff. That was discussing the ability of new players in the market to ask the incumbents to hand over the data. And we're going to see how that works. Okay.
Yes, we're going to slow release some of the clips from that panel along with some other ones over the coming weeks. So people,
even though your friends at Transparent are really slow, quickly released.
Our friends at Transparent are like on the ball. I wonder if that had to do with Accolade announcing that new category yesterday at their Evolve 20.
Personalized healthcare. Exactly what I think about when I think of actually
personalized healthcare.
It should be.
Why not? Personalized medicine, personalized nutrition, or you want to have personalized healthcare in there too.
Fair enough. All right.
If all else fails and you need to, just differentiate yourself, just invent your own category. It's all good.
What's our new category?
Oh, I don't know. Didn't we invent the witty banter delivering health tech news in an untimely fashion category? That should have a catchier name, but I feel like that's us.
How about we call it Health in 2.0 as a category?
It's not a category.
All right. Should we do the Health in 2.0 though?
Why don't we?
All right.
Get your timer. All right, here we go. Commure gets $500 million, brings their valuation up to $3.5 billion. This is human capital and Green Oaks Capital that led this round. Tell me about Commure again, Matthew Holt.
I have no idea what Commure did. It's something to do with API stuff, new technology you can build stuff on, a bit like Jonathan Bush's Zeus thing, maybe. General Catalyst is behind this. Ashwini Zanuz is the president. I asked her to come to the conference to explain what it was all about. She said she was going to come, then she didn't come, I think because she didn't know. I can't figure out, no one can tell me exactly what they do, but apparently they're worth $1 gazillion billion. So well done them.
Yeah, must be doing it well. All right, Spring Health, $190 million for them. This brings their total up to $295.5.
Yeah, another mental health company like all the rest of them. These guys say that they do matching of people to the appropriate care, but frankly, that's what Lyra said 5 years ago, and I still don't see why it's
Everybody says that. I don't know.
Why not? Yeah, okay.
All right, acquisition. UniteUs buys NowPow. What do we know about the terms of this deal?
Nothing, but we do know that NowPow is, it's who's strong in which metro area with network. UniteUs has the biggest network, has raised the most money. NowPow is very strong in Chicago and a few other cities. Similar companies, both doing great stuff to enhance sort of the networks, social determinants of health. So good job.
All right, Nomad, they get 63 million, brings their total up to 113 million. This is healthcare staffing. I interviewed the CEO. What do you know?
I know that you need to, it's a platform. There's another called Incredible Health, which do nurses. So it's the new way to recruit nurses using Nomad. I interviewed the CEO a while back, and I remember nothing about it. I thought they were doing doctors, but you told me after interview.
No, nurses. Nurses. Okay, and what about our friends at Xealth? Did it get it? 24 million, brings their total up to 52 million. They make it easy to prescribe digital health applications from the EMR, the old Epic and Cerner ones.
Well, you said the bit I was going to say, but basically it's an app buried inside Epic, and they have an investment from Cerner before this round, and it's 24 million, and they are basically, it's a tool. You don't have to leave the EMR as a doctor. You can prescribe these digital health programs. It then follows up later as to whether the person actually took the program, whether it's the, a model for diets or whatever it is. You can also buy stuff. So they can sort of via Amazon have you go and buy, God knows, crutches and God knows what else. So it enables the doctor to prescribe to the patient a bunch more stuff than just, it's like an order set management system for digital health. Pretty cool. Now they have 24 million. You think they're going to sponsor our show?
Well, they're totally.
Church, it's a hint to you if you're listening, Not that we've been waiting, or we've had this conversation.
Give us McSherry. We want Mike McSherry.
I saw Mike McSherry at HIMSS. He looked in good form. He was sitting around. Yeah, we had a quick chat. It was all good.
Excellent.
It's an interesting company. The bottom line is they are trying to introduce the outside world of digital health into the inside world of health systems, and my only question is if they raise that much money, I mean, it's like a feature of an EMR, and where does it go as an independent company after this? Because eventually it's got to get sucked into Cerner or Epic or something. I mean, maybe not. Maybe it stays as a feature the whole time. Maybe I'm completely wrong. I just don't know how it grows out of that other, it's probably a good feature. They sell it to every EMR company and they sell it to every hospital system on the planet. And hopefully it will get these digital health programs into the workflow of doctors, which is great. I just don't know how viable the company is because it looks to me like a feature, not a fully fledged product. But they're cool. They're lovely people. Mike McSherry was the guy who put the swipey feature on your phone, on every phone in the world. So he did very well for wake him to root as like an healthcare. I don't know.
Well, see, so maybe his strategy of being a feature for something else is not such a bad strategy after all. Already proved it.
Maybe.
That would have been a good question. That whole idea would have been a good question for that tech infrastructure panel, because it seems to me some of the companies I've been talking to and the ones that we named before, it's like they're building their own kind of way that things get routed, billed, paid for, prescribed alongside what already exists. And so that would be interesting, I think. I
spent 2 hours today with a drug company in Europe, their digital health spin-off thing. No, it wasn't Bayer, it was another one that you know well.
Every one of them.
And they all want to know what platforms were. And in the end, I said, well, here's what a platform is, because they actually gave me a very helpful slide to define a platform. And then I asked their team went, yeah, we think there'll be hundreds and hundreds of platforms. And when in that case, you probably just got a bunch of point applications, really, haven't you? Anyway, so we'll see.
Well, all right then.
We should probably let people go. We have to do another one of these because we have a bunch more to catch up on.
Yeah, we do. So we'll do another one and catch up, and then we'll be good to go here on out. We're headed to the UCSF Health Awards next week.
Next week already?
In person. Yeah, isn't it?
It was the week after.
The week after. No, the week after. You're right. The 7th. Be there for that.
All right.
Yeah, looking forward to it. All right. Well, it's been fun catching up with you.
Lovely to see you again, Mr. Master. You're back to the limit now. Well, so you have to have a bit more of me tomorrow. We'll go from there.
Yes. And if you just can't get enough, be sure to head on over to thehealthcareblog.com, sign up for our email newsletter, and never miss an episode of Health in 2.0 when we do them, or any of the other important news and stories coming out of the blog. And make sure to follow us over there on Twitter. We are doing that. I am at Jess, and he is, of course, at Boy. Ta-da! Done.